Clean hands, healthy patients, the power of hand hygiene. Imagine a world where hospitals are havens of healing, not hotbeds of infection. This is the world we strive for, and hand hygiene is our most powerful weapon in this fight. As healthcare professionals, our hands are our constant companions, touching patients, adjusting equipment, and administering medication. But these same hands can also unwittingly transport harmful germs, putting vulnerable patients at risk. Hand hygiene is not just another task on a checklist. It's a fundamental act of compassion, a silent promise whispered between caregiver and patient. It's a commitment to safeguarding health, preventing suffering, and upholding the sanctity of the healing process. In the realm of healthcare, clean hands are quite literally lifesavers. The chain of infection, how germs spread in healthcare. To understand the profound importance of hand hygiene, we must first grasp how easily infections can spread within a healthcare setting. Imagine a chain, each link representing a step in the transmission of germs. First, we have the infectious agent bacteria, viruses, or fungi lurking on surfaces or residing in bodily fluids. Next comes the reservoir, where these germs live and multiply. This could be a patient, a healthcare worker, or even contaminated equipment. The portal of exit is the route these germs take to escape their reservoir, such as through a cough, sneeze, or open wound. Transmission occurs when the germs travel from one person to another, often via contaminated hands. Finally, the germs find a portal of entry, a cut, the mouth, or the eyes, to infect a susceptible host, a patient with a weakened immune system or an open wound. Breaking this chain at any point is crucial to preventing the spread of infection, and hand hygiene is the most effective way to do so. The price of neglect. Consequences of poor hand hygiene. The consequences of poor hand hygiene in healthcare settings can be devastating. Healthcare-associated infections, or HAIs, are infections that patients acquire while receiving treatment for medical or surgical conditions. These infections are a significant cause of morbidity and mortality, leading to prolonged hospital stays, increased healthcare costs, and unnecessary suffering. The most common types of HAIs include bloodstream infections, pneumonia, urinary tract infections, and surgical site infections. These infections are often caused by drug-resistant organisms, making treatment challenging and costly. Patients who develop HAIs are at a higher risk of complications, longer recovery times, and even death. The emotional toll of HAIs is immeasurable. Patients and their families grapple with fear, anxiety, and the frustration of prolonged illness. Healthcare professionals experience the anguish of witnessing preventable suffering and the weight of knowing that better hand hygiene practices could have made a difference. Hand hygiene's impact. Remarkable statistics. The impact of hand hygiene on infection rates is undeniable. Studies have consistently shown that proper hand hygiene practices can significantly reduce the incidence of healthcare-associated infections. According to the World Health Organization, hand hygiene can prevent up to 50% of healthcare-associated infections. One study published in the journal Infection Control and Hospital Epidemiology found that a hospital-wide hand hygiene campaign resulted in a 21% reduction in healthcare-associated infections over a 3-year period. Another study in the American Journal of Infection Control reported a 35% decrease in methicillin-resistant Staphylococcus aureus infections after implementing an alcohol-based hand rub program. These statistics highlight the remarkable impact that simple hand hygiene practices can have on patient safety. Every time a healthcare worker washes or sanitizes their hands, they are actively breaking the chain of infection and protecting their patients from potentially life-threatening infections. Section 5. The Golden Standard. Proper hand washing technique. Effective hand washing is not a cursory rinse but a deliberate process, each step crucial in eliminating germs. First, wet your hands thoroughly with clean running water. Apply enough soap to cover all surfaces of your hands, including the backs, between fingers, under nails, and thumbs. Lather generously, rubbing your palms together vigorously for at least 20 seconds. This friction helps dislodge dirt and germs. Clean under your fingernails using your other hand's fingernails or a clean nail brush. Rinse your hands well under running water, letting the water flow from your wrists to your fingertips. Finally, dry your hands thoroughly with a clean towel or air dryer. If using a towel, discard it properly. Remember, wet hands are more likely to spread germs, so thorough drying is essential. Section 6. Beyond hand washing, hand sanitizers and their role. While hand washing with soap and water is the gold standard, alcohol-based hand rubs are a convenient and effective alternative when hands are not visibly soiled. These sanitizers contain at least 60% alcohol, which effectively kills most germs. Apply a palmful of hand sanitizer to cover all surfaces of your hands. Rub your hands together vigorously, ensuring the sanitizer reaches all areas, including the backs, between fingers and thumbs. Continue rubbing until your hands are completely dry. Hand sanitizers are particularly useful in busy clinical settings where frequent hand hygiene is necessary. However, it's important to remember that hand sanitizers are not a substitute for proper hand washing when hands are visibly soiled or contaminated with bodily fluids. In such cases, washing with soap and water is crucial. Section 7. Mastering the moment when to clean your hands. Knowing when to clean your hands is just as important as knowing how. In healthcare settings, hand hygiene should be performed at 5 key moments, as recommended by the WHO. These moments are before touching a patient, before clean or aseptic procedures, after body fluid exposure risk, after touching a patient, and after touching patient surroundings. Before touching a patient, hand hygiene prevents the transfer of germs from your hands to the patient. Before clean or aseptic procedures, such as administering injections or handling sterile equipment, hand hygiene protects the patient from harmful germs that may be present on your hands. After body fluid exposure risk, such as contact with blood, urine, or feces, hand hygiene prevents the spread of potentially infectious materials. After touching a patient, hand hygiene prevents the transfer of germs from the patient to the environment or to other patients. Finally, after touching patient surroundings, such as bed rails, bedside tables, or medical equipment, hand hygiene prevents the spread of germs from the environment to your hands. Section 8. Practical tips. Making hand hygiene second nature. In the hustle and bustle of a clinical setting, it's easy to let hand hygiene slip our minds. Here are some practical tips to make hand hygiene second nature. Keep your nails short and avoid wearing artificial nails, as they can harbor germs. Remove rings and bracelets, as they can make hand hygiene less effective. Use a moisturizing lotion regularly to prevent dry skin, as cracked skin can harbor germs. Be a role model for your colleagues and patients by practicing good hand hygiene consistently. Speak up if you see someone neglecting hand hygiene, reminding them politely of its importance. Make hand hygiene a team effort, encouraging everyone to take responsibility for maintaining a clean and safe environment. Remember, every time you clean your hands, you are making a difference in the fight against infection. Section 9. Champions of cleanliness, nurses leading the way. As nurses, we are at the forefront of patient care, spending countless hours at the bedside. We are uniquely positioned to champion hand hygiene, not just as a task, but as a core value that underpins everything we do. Our actions speak louder than words, and when we consistently prioritize hand hygiene, we inspire our colleagues, patients, and families to do the same. We can educate patients and their families about the importance of hand hygiene, empowering them to be active participants in their care. We can advocate for resources and policies that promote and support hand hygiene practices in our workplaces. Let us be the generation of healthcare professionals who break the chain of infection, one clean hand at a time. Section 10. A healthier future. Your hands, our hope. The future of healthcare hinges on our collective commitment to infection prevention, and hand hygiene is the cornerstone of this endeavor. Your hands have the power to heal, to comfort, and to protect. By embracing hand hygiene as a non-negotiable aspect of our practice, we can create a healthier future for our patients and ourselves. Let us remember that every hand wash, every squirt of sanitizer, is an act of compassion, a testament to our dedication to providing the best possible care. Together, let's make hand hygiene a habit, a reflex, a source of pride, for it is through clean hands that we build a safer and healthier world.